In this podcast episode, Dr. Jeremy London, a board-certified cardiovascular surgeon with over 25 years of experience and nearly 7,000 heart surgeries under his belt, shares invaluable insights into heart health, disease prevention, and the often overlooked signs of heart trouble. The discussion covers a broad spectrum of topics, from the physiological and emotional causes of heart disease to lifestyle factors that can either protect or harm the heart. Dr. London begins by emphasizing that heart disease remains the #1 cause of death worldwide, surpassing cancer, which many people mistakenly fear more. Each year, approximately 20 million people die from cardiovascular conditions, with the most common culprit being blockages in the coronary arteries. These arteries supply oxygen and nutrients to the heart muscle, and when they become narrowed or blocked, primarily due to cholesterol buildup, heart attacks occur. While blockages are the predominant cause, heart disease can also stem from valve problems, electrical system abnormalities, or congenital defects. He stresses that heart disease does not develop in isolation. The body functions as an interconnected system where mental, nervous, and cardiovascular health influence one another. Stress, while not a primary risk factor, plays a significant role in exacerbating heart conditions by placing additional strain on the heart. One of the most surprising revelations Dr. London shares is how subtle the early symptoms of heart disease can be. Unlike the dramatic chest pain often portrayed in media, many patients experience mild or atypical symptoms such as chest tightness, shortness of breath, or even abdominal discomfort that only appear during physical exertion and subside with rest. This pattern, known as stable angina, is a critical warning sign that should never be ignored. Dr. London compares it to a Charlie horse in the calf muscles, pain caused by insufficient blood flow during activity. Recognizing and acting on these early signs by seeking medical evaluation can prevent more severe events like heart attacks. Dr. London identifies obesity, poor diet, insulin resistance, high blood pressure, diabetes, and sedentary lifestyles as the primary contributors to heart disease. Smoking remains the single worst habit for cardiovascular health, damaging arteries and increasing the risk of blockages dramatically. Vaping, a relatively new phenomenon, especially prevalent among younger generations, is discussed with caution. Although long-term data is lacking, Dr. London has witnessed severe, sometimes fatal cases linked to vaping, including a condition called EVALI, e-cigarette or vaping-associated lung injury. Nicotine, common in both cigarettes and vaping products, constricts blood vessels, raising blood pressure and forcing the heart to work harder, which can lead to heart failure over time. A staggering 50% of Americans have high blood pressure, yet most are unaware of it. Dr. London explains how elevated blood pressure damages the elasticity of blood vessels, leading to stiffening and atherosclerosis, hardening of the arteries. This condition forces the heart's left ventricle to thicken and work against increased resistance, eventually causing heart failure. Fortunately, high blood pressure is one of the most modifiable risk factors. Lifestyle changes such as improved nutrition, regular aerobic and resistance exercise, stress management, and when necessary, medication can significantly reduce blood pressure and improve heart health. The conversation takes a poignant turn when Dr. London confirms that emotional trauma can indeed cause physical heart problems. Broken heart syndrome, or Takotsubo cardiomyopathy, is a real and recognized condition where intense emotional stress, such as grief, financial loss, or a breakup, triggers acute heart failure symptoms that mimic a heart attack. This syndrome is more common in women over 55, but can affect men as well. While the exact cause remains unclear, it is believed to involve overstimulation of the autonomic nervous system. Most patients recover with supportive care, but the condition can be fatal in some cases. This underscores the profound connection between mental and cardiovascular health. Dr. London clarifies the differences between heart attacks, strokes, and panic attacks, which are often confused due to overlapping symptoms. A stroke results from interrupted blood flow to the brain, typically caused by blockages in the carotid arteries, and presents with sudden facial drooping, speech difficulties, and weakness on one side of the body. A heart attack involves persistent crushing chest pain, shortness of breath, and pain radiating to the jaw or arms. Both require immediate emergency response by calling 911. Panic attacks, while physically distressing and sometimes mimicking heart attack symptoms, are usually triggered by emotional stress and are self-limiting. Importantly, panic attacks do not cause heart attacks. Dr. London advises that when in doubt, seeking emergency care is always the safest choice. Alcohol consumption is addressed candidly, with Dr. London highlighting its toxic effects on every cell in the body. Alcohol breaks down into acetaldehyde, a poison, and acetate, which contributes to fat accumulation, particularly visceral fat around organs, a key driver of inflammation and heart disease. He predicts that alcohol may soon be viewed with the same caution as tobacco, potentially carrying warning labels due to its health risks. Personally, Dr. London has abstained from alcohol for years and credits this decision with significant improvements in his health and quality of life. Sleep hygiene is another pillar of heart health. Quality sleep supports brain detoxification, glucose metabolism, and blood pressure regulation. Poor sleep, including conditions like sleep apnea, increases the risk of heart disease. Dr. London rates good sleep as essential, equating its importance to exercise and diet. Dr. London advocates for daily movement, combining aerobic exercise to improve cardiovascular efficiency, VO2 max, with resistance training to maintain muscle mass, which is crucial for metabolic health and functional independence. He also emphasizes the importance of nurturing relationships, citing his father's advice to keep friends close as a vital factor in longevity and emotional well-being. When discussing how to approach lifestyle changes, Dr. London stresses the importance of small, manageable steps rather than overwhelming transformations. He acknowledges the emotional and psychological barriers many face, especially those struggling with obesity, and encourages compassion balanced with accountability, identifying personal weaknesses, whether poor sleep, diet, or inactivity, and focusing efforts there can yield the greatest health improvements. Throughout the interview, Dr. London's humility and dedication shine through. He describes the honor of holding a patient's heart during surgery and the emotional toll of patient loss, which remains as difficult after decades of practice. He shares how he mentally prepares for surgery by visualizing worst-case scenarios and planning responses, underscoring the importance of training and readiness. He also reflects on the spiritual and human aspects of his work, balancing technical skill with empathy and trust. While not overtly religious, Dr. London identifies as spiritual and strives to make patients comfortable and cared for beyond the physical procedure. Dr. London concludes with a powerful definition of greatness as the willingness to change and remain open to growth. His journey from a young medical student to a seasoned surgeon and health advocate illustrates the lifelong commitment to learning and adaptation. For those seeking to improve their heart health, Dr. London's message is clear. Recognize the subtle signs of heart trouble, prioritize lifestyle factors such as exercise, sleep, and relationships, avoid harmful substances like tobacco and excessive alcohol, and seek medical care promptly when symptoms arise. Above all, he encourages self-awareness and incremental progress, reminding us that even small changes can profoundly impact longevity and quality of life.